Hello everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing a little obscure muscle known as the Pronator Quadratus. It's a little flat muscle that lives on the distal anterior surface of the forearm just above the wrist. It's the deepest of all the musculature that lives under the flexor tendons. Its primary role in life is to pronate the forearm with any degree of elbow flexion. So if the elbow has any bend in it, the Pronator Quadratus is active. This muscle is innervated by the anterior interosseous nerve, which, if you remember from a previous video, goes through the two heads of the Pronator Teres, a muscle that lives more superior than the Pronator Quadratus. The Pronator Quadratus is very unique in that it can mimic inner elbow pain. It can mimic nerve involvement of ulnar nerve. It can cause both volar and dorsal finger pain from the third, fourth, and fifth digit. So make sure that you have an accurate human movement diagnosis first to know what is indeed causing your elbow, forearm, wrist, or hand pain or digit pain, especially if it's third, fourth, and fifth. A certain patient comes to mind who was told that they had ulnar nerve neuropathy, and while their EMG test was inconclusive, they continued to complain of third, fourth, and fifth digit numbness tingling. I thought to myself, it's interesting that the third digit had pain in paresthesias, as the more typical pattern with ulnar nerve involvement would be the fifth digit and the ulnar half of the fourth. We started to do an exam, did resisted pronation, palpated the Pronator Quadratus, and lo and behold, we start reproducing the patient's symptoms. What is an exercise program to treat pain and dysfunction of the Pronator Quadratus? I personally like to use my own hands to lightly mobilize the muscle on the anterior aspect of the ulna and radius. You can start with 10 to 20 quick strokes to improve blood flow and the temperature of the lateral aspect of Pronator Quadratus as you activate it. The elbow is flexed and I'm supinating and pronating my hand. I then do this quickly 20 to 30 times on the medial aspect of Pronator Quadratus. Next, I'm going to do my best to get right down to it. We have to be very specific when we do this, as the muscle is only about 1.5 to 2 inches thick, or I should say from proximal to distal, 1.5 to 2 inches long. I am not on my flexor tendons. I am under the flexor tendons on the anterior aspect of the distal radius. Interestingly, just as I mobilize this muscle, I start to feel some abnormal pains and sensations into my hand. On this side, I feel it more on the dorso-medial side of the hand. Now I'm working the ulnar portion of Pronator Quadratus, and as I work it, I am feeling inner forearm pain, inner wrist and medial hand, fourth, fifth, and even part of the third digit. An initial starting dose is to spend 5 to 10 minutes mobilizing the Pronator Quadratus. Here I'm using active release, supination for reciprocal inhibition of the Pronator Quadratus. I can also do contract, relax, audiogenic, contracting it, hold for 5, 4, 3, 2, 1, and relax. Repeat 3 to 5 times. And then I'm going to end with static stretch of Pronator Quadratus. I'm on the distal aspect of the radius and ulna, just above the wrist, holding 30 seconds to a minute with my elbow bent. Repeat 3 to 4 times as an initial starting dose. Twice a day on the stretch, once a day on the muscle mobilization. Repeat the stretch twice a day, and hopefully within 1 to 2 weeks or 3 to 4 weeks, you can have resolution of the symptoms into the wrist, hand, and 3rd to 5th digit. If you've liked our Pronator Quadratus video, please hit the like button, the subscribe button, and please share it with your friends, family, patients, and colleagues. Take care, and see you all again soon.